The sustainability of life and happiness depends on many factors. One of those factors is the contentment that comes through body aesthetics. Humans thrive on the sense of beauty and appearance. Moreover, beauty has directly been linked to youth and newness for ages now. Hi, I am Dr. Priya Bansal, a board-certified cosmetic plastic surgeon practicing in Delhi, Gurgaon and NCR. Today, I want to talk to you about a very sensitive topic that many women face all over the world. It is specific to women who have experienced childbirth. That is the loosening of vaginal walls post-delivery or due to aging. While physical disfigurement of the vaginal tract and the outer appearance is common after childbirth, many women experience a lowered sexual drive too after childbirth. This primarily happens as they lose confidence in their own body, especially the lower anatomy. This even leads to lower self-esteem and depression. It will not be an exception to say that women miss the tightness of their vaginal parts, which was there previous to childbirth. Also, after delivery, the vagina is permanently D-shaped, and sometimes this can cause pain during exercise or sexual activity. The science of cosmetic and reconstructive surgeries hold a solution to this problem, which is called as vaginal rejuvenation or vaginal tightening. So before we discuss the procedure, we need to understand the female genitals, the anatomy of the female genital. Only then you can really understand the parts which are affected and how they are affected. So first we need to establish that this whole anatomy is called vulva. Now, the outermost region of this vulva, the outer lips, is also called labia majora or the outer lips. The fold present inside this outer lips is called the inner lips or the labia minora. At the top of this labia minora is a hood-like thing which is called the clitoral hood. And underneath the clitoral hood is the clitoris, the sexual organ. Beneath the clitoris is an opening which is called the urethral opening from where you pass urine. And below the urethral opening is the opening of the vagina which is called the vaginal opening. So this vaginal opening leads to vagina. Now both this urethral opening and the vaginal opening, they lie in the vulval vestibule. So this is the anatomy of the whole female genitalia. Now once we have understood this anatomy, we can talk about vaginal and genital rejuvenation. So vaginal rejuvenation is precisely as the name suggests. It is the rejuvenation of the vagina. A lot of women feel that the structure of their vagina pre-childbirth was better, or maybe the vagina has loosened because of age. Either way, they feel that they do not like it. And this may even result in loss of sexual pleasure. Part of the reason vaginal rejuvenation is popular is because of something which is called as labia hypertrophy or labia enlargement. This is when the labia minora, the inner lips, they enlarge. They increase in size. This can be genetic as well as environmental. Some women are simply born with a large labia. Other women, they experience the labial enlargement because of either childbirth or due to aging. This hypertrophy in the labia minora, it may stick out beyond the majora and it looks like this. Now, although this is completely harmless, some women may want their labia minora tucked inside the labia majora, which is the normal anatomy. And for these women, vaginal rejuvenation is the way to go, by excision or by tucking of the labia minora. So vaginal rejuvenation is typically a daycare procedure. It is a quick and straightforward procedure, and usually it consists of two aspects, vaginoplasty and labiaplasty. Vaginoplasty is the tightening of the vaginal walls, whereas labiaplasty involves the reduction of these enlarged labia minora. Sometimes it also involves this clitoral hood remodeling, and it can also involve addition of fat to the labia majora, which may have shrunk, which may have become lax because of aging. For vaginal rejuvenation, we can also use non-invasive, non-surgical technique like radiofrequency in patients who have minimal laxity of the vagina. Now, being a non-surgical method, it is a desirable option for many patients who may be worried about the idea of surgery. It is quick, it produces good results. The procedure can be done under local anesthesia and it takes only 30 minutes, although the procedure needs to be repeated at interval. Now, what happens during the procedure? A jelly is applied to the treatment area and either laser or radiofrequency energy is used. This energy, it helps in contracting and tightening the vaginal canal, the vaginal mucosa. This shrinks and tightens the outer tissues. It stimulates collagen remodeling, elastin fiber production, and it causes the tissue and nerve healing and increases the firmness of the mucosa, making it firm and supple. So essentially what it causes is micro damage to the vaginal tissue, which in turn, it tricks the body into repairing itself, and then it stimulates the new cell growth, collagen, elastin formation, angiogenesis, and all of this at the site of the injury. So this leads to thicker tissue, which makes the vagina feel tighter. But we need to understand that this non-surgical procedure, there's an eligibility for that. If the vagina is not too lax, it can be tightened with the help of multiple sessions of non-surgical vaginal rejuvenation. Now, recovery after a vaginal rejuvenation procedure, be it surgical or non-surgical, is very easy. The patient needs to wear a sanitary pad for a few days. They need to use ice packs to decrease the swelling. They can use genital hygienic wash to keep maintain the perineal hygiene, and it is advised to keep the pelvis elevated with a pillow below the pelvis, again to decrease the swelling. Now, most of the swelling is gone by 2 to 3 weeks time, and in 4 to 6 weeks time you can feel and see the results which have been provided. Being a daycare procedure, you are discharged from the hospital the same day. You can resume your normal daily activities. The only thing you need to refrain from is sexual intercourse for 6 to 8 weeks after a surgical vaginal rejuvenation procedure. In all my vaginal rejuvenation procedures, I aim for the most natural looking and aesthetic results. I believe every surgeon must genuinely understand their patient's needs and make the patient comfortable to be able to talk to you comfortably about their problems. This is a delicate procedure, and I always treat my patients with compassion and respect when they come to me, especially for this kind of a procedure. Being a female plastic surgeon, my patients, they feel comfortable discussing their result-related aspirations, their expectations, and their problems related to vaginal surgery. It is about time we stop stigmatizing the need for vaginal rejuvenation procedures. As we can clearly see, they may help many women lead a better, fulfilling and happy life. I hope I have answered most of your questions about vaginal procedures. However, if you still have some questions, please feel free to write to me in the comment section and I will be glad to answer them. You can also connect with me on Facebook and Instagram. The details are given in the description section. I have a closed community on Facebook by the name of Woman Ki Baat. We talk, we discuss, we share and understand many women-related issues and problems which we cannot discuss in the open. You all are welcome to join the community and let's talk there. I'll be here soon with details of another life-changing procedure. Stay tuned to this space. Take care. Bye-bye.